Welcome everyone to this webinar entitled The First Decade of Action for Road Safety, a Roadmap for the Future, organized by the Center on Commercial Determinants of Health at the Milken Institute School of Public Health at George Washington University. In September last year, 2020, the United Nations General Assembly adopted resolution improving global road safety and proclaimed the Decade of Action for Road Safety 2021-2030 with the ambitious target of preventing at least 50% of road traffic injuries and deaths by 2030 globally. Earlier today, the World Health Organization launched the global plan for the second decade of action for road safety. The plan was developed by the World Health Organization, the UN regional commissions in collaboration with partners of the United Nations Road Safety Collaboration and other stakeholders. The plan is a guiding document to support the implementation of the second decade of action and its objectives. I'm very happy to have two very distinguished road safety experts here today with us, who will speak about the success and limitations of road safety efforts over the past 10 years and make recommendations for the future as we enter a new decade of action for road safety. In 2019, a rapid evaluation of the first decade of action for road safety 2011-2020 was undertaken by a subgroup of the UNRSC members, led by the academics from George Institute for Global Health, the George Washington University, World Health Organization, and MAPFRE Foundation. A logistic model was used for the evaluation using both quantitative and qualitative methods to assess outputs and outcomes. These included the retrospective analysis of the 3 global status reports for road safety data, an online survey involving key road safety stakeholders, in-depth interviews with 18 experts in global road safety, as well as literature review to find country-specific case studies. Dr. Peden and Dr. González will present some of the results of this evaluation today. So with that, please let me introduce our first speaker for today, Dr. Margie Peden. Dr. Peden is Senior Research Fellow, Head of Injury at George Institute, and co-director of the World Health Organization Collaborating Center on Injury Prevention and Trauma Care. Dr. Peden is an injury epidemiologist with decades of experience in injury prevention and public safety. She was the executive editor of both World Reports on Road Traffic Injury Prevention and Child Injury Prevention, and she headed the WHO Unintentional Injury Prevention team for 17 years. Her academic interests include identifying and evaluating interventions to prevent child injuries, low-income settings, and implementing frameworks to include trauma care. With that, I'll give floor to Margie. It's all yours. And please, everyone, if you have any questions, please feel free to put them in the chat and we will address them during the Q&A session. Thank you.
Thank you very much, Nina. And it's really great to be with you all this morning. I think most of you are still in your mornings. I'm sitting in the United Kingdom, so it's early afternoon for me. But it's a very important day today. As Nina mentioned, we just listened to the launch of the new second Decade of Action plan from the WHO a couple of hours ago. So I'm going to walk you through some of the mainly qualitative research that we did around the evaluation of the decade of the first decade of road safety. So let me go ahead and share my screen with you. All right, we're good. I'm just going to make it big. And to start off, I want to thank my other colleagues that were involved. This was a subgroup, as Nina mentioned, of the UN Road Safety Collaboration. My colleagues, Nina, who you see, as well as Jesús, Meliki Kaizi from WHO, Prashanthi Purvanachandra, Adnan Haider, and Imran, who is also on the call. And we were very gracious to receive funding from the Fundación MAPFRE for this. So this is not my own singular work. So as Nina mentioned, and I won't labor the point, we actually used mixed methods, looking at the analysis of the global status reports, the 3 reports that were published over the decade. And there is a paper, as I understand, and I think Heather is probably on the call as well. There is a paper that is about to be published. We also reviewed the published literature, looked at the Secretary General reports that had been published over the decade, did an online survey using Qualtrics, and then these in-depth interviews that I mentioned earlier. So both quantitative and qualitative approaches. And pretty much, I'm sure most of you are aware of this, there was very little improvement that could be seen through the 3 status reports. There was pretty much a plateauing of numbers, which in and of itself wasn't a bad thing, because population numbers, I guess, populations were going up and vehicle ownership was going up, etc. But really levels remaining unacceptably high, despite all the input that had been put in through the decade of action. There were some improvements in some high-income countries that we saw. In fact, there were some slippages in high-income countries that we saw as well. And there were very few changes in legislation over the decade, but we know that it takes years and years and years to change a decade. I looked at, did a rapid scoping of what had been published around the decade. We did it in English, Spanish, and French. There were a total of 79 articles at that time that met the criteria. They came from 18 different countries, but most of them, in fact, were regional papers talking about regional aspects. And there was not one single paper that actually provided details on the actual programs that they were implementing within the context of the decade of action. Our colleague Meliki Kaize at the World Health Organization looked at the 4 or 5 Secretary General reports that had been published over the decade. He did a content analysis of these. They covered 116 countries' activities. But the bias with this analysis, and it has been published in the BMJ Open, as you can see here, was that it was all reported by UN Road Safety Collaboration Partners. And so it was basically members of the choir reporting about what songs they had been singing. And so not a huge amount of additional information was received by analyzing the Secretary General's report. So moving then on to the 2 other aspects that I wanted to talk a little bit about, the first one being the in-depth interviews and the other one being the online survey, which Nina ran from George Washington. The interviews, we approached 19 people, 18 agreed to take part. I had equal numbers of men and women. They were from different countries. They were different international organizations and NGOs. We tried to cover as much as possible expertise in health, transport, police, policy. We used a structured interview question with an interview sheet with about 18 questions, and Jesús helped me with the Spanish, doing a couple of these interviews in Spanish. So, sorry, this thing is moving along by itself. We transcribed using NVivo Transcribe, and it was also analyzed using NVivo. There were, as I say, 18 questions. Some of them, the 3 main questions that I want to talk about here was, do you think the Decade of Action was a success? Was the global plan for a decade useful? And then at this time, remember, we were conducting this in 2019, was whether the participants thought there should be a second decade. So, I mean, this is not rocket science, basically experts kind of sat on the fence, which is what we had predicted would happen. And so the average score they gave the decade out of 10 was 5, although the range did range from 2, there was one particularly disgruntled participant, to 8 very optimistic participant on the other end. And basically their answers depended on who I was asking. Those that worked at an international level and were very invested in the plan thought it was a resounding success, while those who worked at a country level were much less enthusiastic. So here are some of the comments that the participants told us. They thought it was a success compared to what we had had before, and yes, probably that was true. There was one participant who thought that despite the fact that there was plateauing of the numbers, that there was still success because the projected numbers that WHO and the World Bank had come out with some years before had not been reached, and so it was a success in that terms. Lots of people talked about the visibility, and yes, the decade probably did give a lot more visibility to road safety, and in a way it did galvanize the international community. One NGO participant in particular thought that it was very helpful to have agreed language, and that there was global backing and an evidence base for the work that they were conducting in countries. So in general, the whole awareness raising exercise seemed to be a very positive aspect. But there were also participants who thought that there were very negative aspects and that the decade had failed as far as funding in particular. There were a number of delegates, particularly those from country level, who basically didn't feel that there was funding commensurate with what the decade was promising to do. That we had spent a decade basically generating documents and hadn't actually done anything on the ground. And that there was a lot of criticism around implementation, and that we had not learned lessons from other fields around how to push forward a decade and how to use a decade from an advocacy point of view. Many also felt that the framework, although it was useful for the decade of action, didn't translate down to a local. So there was a lot of criticism as well as a lot of positive. When we looked at the online survey that Nino did, we categorized it into whether they were from the country or whether they were talking for their organization or whether they were talking globally. And it was really interesting how it differed as to whether they thought it was a resounding success or a complete failure, depending on where they sat. Again, with the international people who were invested in the plan, thinking it was great, and the people in the country who didn't see the implementation trickling down to them and the funding trickling down to them, thinking it was less of a success. The question around the framework or the 5 pillars, the Decade of Action 5 pillars, unanimously people felt was a useful way of framing things that in the past we had had a much looser framework, that this was much more rigid, that countries understood it, that many countries adapted it in their own action plans, that figure with the 5 pillars was seen across the world in multiple documents. And it certainly drew attention to certain elements of the plan, particularly the road safety management pillar and the post-crash pillar. Although some delegates did feel that some participants that I interviewed felt it fell short and really should have had a speed pillar, for instance, by itself. So when we asked them about the contributions to the success of the decade in the online survey, it was actually interesting here that you would see that globally participants thought that there had been an increase in funding, but that people in the countries didn't agree with them. So that money was not getting through down to a country level, whereas globally, people didn't feel that there had been any improvement in data and data collection over the 10 years. And yet almost a quarter of the people in the countries that completed the survey actually thought that their data had improved. So very interesting discrepancies there. But the thing that came out repeatedly over and over, and I'm not going to labor the point anymore, was that there wasn't money that was attached to this, that there remained a capacity problem in countries. So even when there was money, there was nobody trained to actually do it, that more political will was needed. And when there was political will, there was money that followed. And that the preaching about multi-sectoral collaboration really remained a challenge. So these were some of the challenges they identified. We asked them at that point, we hadn't had the Sweden conference when I was interviewing people, and so we asked them whether there should be a second decade, and 78% of people said yes, but that there would need to be a much better focus, that there would have to be a much more sensible target, that it would have to be much more regionally based, more strategic in terms of getting political will, and a much clearer focus. Again, obviously, with the issue of funding coming through there. As far as the challenges that participants wanted to see addressed, the post-crash area was a deficiency. Many of the non-governmental organization people talked about justice, inclusive mobility, and gender equity, other issues of equity not being addressed appropriately in the first decade plan, and wanting to see that in the new decade. They also wanted much more of a focus on youth, as road traffic crashes are a big killer of children and young people. And they wanted to see much more interaction and much more of a how to do this and how to implement this in countries, and better monitoring and evaluation. They felt that that was a bit weak, so that there should be a much more comprehensive monitoring and evaluation framework right from the get-go. So some of the other reflections that I took away from interviewing this group of 18 people was this real confusion that there was around what the goal of the decade actually was, because we started with the goal of the decade being this 50% reduction in this projected increase in road traffic crashes that WHO and the bank had published some years before. And then we had SDG 3.6 come in, which only ran until 2020, which in itself was a confusion. But that goal said that it should be, a 50% reduction in absolute numbers. And so there was lots of misunderstanding about what that was. There was also these big issues around capacity development, and really countries felt very unsupported as far as capacity development, and that the capacity development needs had not been met, and that multi-sectorality was really just lip service. As well, the NGOs felt that they'd kind of been left off the table, so to speak, in particular the victims' organizations, and that they should have much more of a voice in the new decade. So our conclusions in terms of the whole package, and here I'm talking about the whole package, not just the interviews, was that the decade was a success in terms of awareness raising, the weeks, the conferences, the days, etc. That we had 2 SDGs that related to road traffic injuries come through, that there was funding coming through at a global level. We can't say that there was no funding. It just didn't trickle down as much as countries would have liked it. That the NGO Alliance was set up, that there were capacity development efforts, that there had been some data improvement in countries, and there are a few case studies where that was true, and that there had been an increase in the care, the trauma care focus, and in fact funding for trauma care. from a couple of donors, but there needed to be more focus on political will, regional activities, targets, and continued capacity. So this is the new Decade of Action plan that Nan and Etienne and others launched just a couple of hours ago, which is much more focused on the safe systems approach. So I want to end then by just saying what and this is a personal view, this has not been discussed with any of my co-authors, but having read and been involved in the preparation of the new plan, review of the new plan, what I think it does address. So I think it does address some of the issues that we've raised in the first decade. It does use the safe systems approach. It does focus on low and middle income countries and vulnerable road users. It definitely has a strong focus on safer mobility and urban planning. Infrastructure and speed. It does address the issue of gender equality and brings that right to the forefront. And it definitely engaged with advocates, particularly the youth. The youth were involved in reviewing the document, and a lot of their inputs were included. But I still think that it falls short in a couple of areas. It falls short in addressing co-benefits. I really think this is a missed opportunity. I think we really should be looking at road safety and how it interacts, how it benefits air quality, obesity, NCDs, greenhouse gases, you name it. I think that the role of research in the report is just playing lip service to research, and I think that can be better expanded. The monitoring and evaluation framework that is there is quite generic, and I think we probably need quite a lot more work. I'm sure Nina would agree with me that I'm not sure that commercial determinants of health as they relate to transport are even mentioned in the document. And I think that my colleagues from NGO victim organizations would say it still falls hopelessly short as far as the end point of the post-crash crash investigation and justice for victims is concerned. So Nina, I think I'm going to stop there and hand over to Jesús, who can give us the Latin American viewpoint. I'm happy to take questions afterwards. Thanks.
Thank you so much, Margie. This was fantastic. And I loved your last concluding slide with your summary of the advantages or some disadvantages of the new decade. Let me now introduce our second speaker, Dr. Jesús Monclús González. Dr. González is the Managing Director of Prevention and Road Safety at Fundación MAPFRE. Dr. González has his master's degree in transport safety and doctoral degree in industrial engineering. He has spent the past 2 decades working to improve policies and enhance understanding of road safety. He is the author of 2 books, Planes Estratégicos de Seguridad Vial, Fundamentos y Casos Prácticos, and La Seguridad Vial en las Empresas Programas Internacionales de Promoción. In 2019, Dr. González received the Medal for Road Safety Merit by the Spanish Directorate General for Traffic, which is a prestigious award that honors his commitment to enhancing and promoting road safety. Dr. González, the floor is yours.
Hello, good morning, good afternoon. Let me start by acknowledging also the great team that I have the privilege of working with here in Madrid and in other countries. And I also want to thank the Milken Institute for organizing this webinar. And I also want to say that we really feel very privileged to be part of this evaluation together with the George Institute for Global Health. And as explained before, I'm going to give a complementary vision perspective from the victims associations in the Latin America area, which is actually our main focus area of Fundación MAPFRE outside, of course, Spain and other countries. Let me share my presentation. And if you can let me know when you see it, I will fire it up. Can you see the slides, I think? I hope. Okay.
Yes, all is good.
Thank you. So let me also explain that Fundación MAPFRE is a non-profit organization with more than 45 years of trajectory. Our main goal is to improve the quality of life of individuals and the society. And we've been working on road safety since 1996. So we've been working for more than 25 years now. We are members of the European Transport Safety Council, members of the United Nations Road Safety Collaboration, that explains our participation in the evaluation, also members of the Safe Kids Worldwide Network, and also, for instance, the American Firefighters Organizations. You can see here now our international footprint that started from the Philippines. If we start from the right to the left, to several countries in Europe and in the United States, Mexico, and all large countries in South America, Central and South America, except from Bolivia. So you can see here the cover page of our report. It was published in Spanish and English, and it was made by the Ibero-American Network of Victims Associations, FICVI. So I feel also let me say that I feel very humble also to be presenting on behalf of the Victims Associations their main conclusions. The objectives of the report, the investigation, was to reflect on the progress made from the perspective of victims associations in the Latin American region, Ibero-American region. That means that, there's a lot of focus on the fifth pillar, and you will hear about that later. So the method regarding the method, it was also, it started with an analysis of the WHO and WHO reports, the Pan American Health Organization reports, complemented also with information from website of relevant organizations, and finally an internal consultation, and similar to the in-depth interviews that Dr. Peden referred to before, among FICVI members, including testimonials. And I mean, there are no scientists. Most of the FICVI members don't come from the academic scenario, but they're really knowledgeable of how road safety is being managed. They're actually main actors of road safety policy in some of the countries. So they're a very credible and very, of course, as always, motivated voice. Well, I want to stop on this slide because, I was just wanted to highlight with this slide that there's been a lot of progress in the last decade, mostly in the last decade. I wrote here that, maybe it's not fully fair, but, most of the things started back in 2004 with the publication of the first global report. And then you can see here that there are a lot of milestones, and Margie referred to, for instance, the constitution of the Global Alliance of NGOs in 2011, which actually was the same year when FICVI in Latin America was founded. So, I liked very much, I didn't bring it here, but the graph that Margie showed about the numbers, how the trends in the number of fatalities during the decade. And so this 5 out of 10 rate was also, can be summarized, as you can see here, with the analogy of the half empty, half full glass or bottle, half success and half failure. At the end of the decade, more than 1.3 million lives lost every year is a tragedy of tremendous magnitude still. But compared to the projections of 1.9, we could maybe even claim that 700 million lives, 700,000 million lives are saved every year when compared to those initially projections. We also know that the mortality rates have stabilized in high-income countries, but not in low and middle-income countries. So when trying to summarize the report and trying to explain what went well in the Ibero-American region. Ibero-American because it also includes Spain, for instance. So we see here some of the also milestones or highlights of this decade in Latin America, starting with the constitution of FICBI, the Ibero-American Federation, in 2010, when they also proclaimed the Declaration of Medellin. I will refer again to that later on. Also the launch of the decade in Mexico. Together with FICBI, we are really proud that we've been releasing almost yearly reports in connection with the fifth pillar. That pillar that, you know, as Margie mentioned, was one of the less developed during the past decade. And you see here, I would like to just mention the Ibero-American Comprehensive Guide for Crash Victims that sets the roadmap for, let's say, developing or improving this post-crash pillar. Of course, Latin NCAP, that was launched right at the beginning of the decade, or the Ibero-American Observatory. One of the accomplishments of the last decade was the setting of regional observatories. The first one actually was the Latin America Observatory, or ICEBI. Now a total of 26 countries are members of the observatory, but, you know, within brackets, within parentheses, I also wrote that, you know, it clearly must grow stronger in the next years. Of course, this Road Safety Fund, the United Nations Road Safety Fund, that is actually developing, supporting a project in Argentina related to speed management, that, as we saw some minutes ago, it's become one of the prerequisites and requirements for road safety according to the newly released Right Today global plan. I also want to mention the Federal Network for Assistance to Traffic Victims that was created in Argentina, led by the National Road Safety Agency a couple of years ago, and also the Ibero-American Road Safety Program launched in 2018 by the Ibero-American Secretariat together with the Ibero-American OICEBI, and Ibero-American Observatory, sorry. And finally, the creation of REDUX, which is an independent research council, similar, well, not just research, but something similar to the European Transport Safety Council, that, you know, is actually being part of this project in Argentina, being funded by the United Nations Road Safety Fund. Okay, probably even more important is to reflect on what went not so well in the region. And probably most of these points here are also common to other regions. Before I start to mention some of them, I also want to highlight that, you know, this sentence from Winston Churchill. So, you know, we must keep our faith, our enthusiasm, our motivation, even if we know that there's a long way in front of us. So there's, according to the victims, and you know, from MAPFRE Foundation, we adhere to their conclusions. There's an insufficient political will in general terms, or, you know, in other words, there's a need to move from political will to specific actions. And, you know, at this point, let me just stop for 1 second and say that today we are presenting these evaluations, and I have a sincere sense of pride, because most of our recommendations, our claims, our demands, our requests, even if there are some gaps, and as Margie presented, there's still some issues to tackle in the future. A lot of the recommendations have been included in the new global plan. And I don't want to say that it was because of the FICBI report or evaluation. It was not just because of the evaluation with the Milken Institute and the George Institute, but together with other evaluations and together with the great work led by the World Health Organization teams and other agencies, we think that we've made a change, we've made a difference. One particular issue in the Latin American region is the second bullet point in this slide, is the lack of stability in technical bodies. I'm trying to say that, every time that there is a change, national elections, a change in the government, a lot of people, knowledgeable with experience, they change positions. Some of them go to consultancy bodies, international bodies, but this actually, we recently released a report together with the General Directorate for Traffic about how Spain did relatively well in reducing during the last decades crashes. One of the main points was to have strong, not just a strong agency that needs funding, but with stability in the technical bodies, in the civil servants, the researchers. Also, the lack of progress, that's really very clear in the Ibero-America, in the Latin American region regarding the driver license methods. So there's no sound method for driver training in some countries or some jurisdictions. You can still buy, you pay, some tens of euros or dollars, you just write your license. Too many laws that cannot be implemented. This is another problem. I mean, if you become familiar with some policies in the region, you will see that, they normally have a lot of laws. So it's not a question about the law, it's about the question about how the laws are implemented. And also, I was very happy to read in the global plan and this sentence about the prevention of corruption. So I wrote here, trying to be more politically friendly, lack of credibility of enforcement. But actually, in some countries, when say, and actually, that's very symptomatic, because in a lot of meetings, when you meet people and then you discuss about, how when people are stopped by enforcing agencies, the most common sentence is, officer, how can we deal with that? What can we do about this? How can we solve that? It's an indirect way of offering, in many cases, money for not getting the fine. Also, differences inside countries. In Mexico, for instance, you change from one state or to another one, then legislation might be different. And also, in general terms, for many countries, and this is very important, it is also reflected in the new plan, limited commitment from a lot of countries toward vehicle safety. I mentioned Latin NCAP, but in many countries in the region, there are no specific technical specifications. The countries have not adhered, have not signed the UN technical vehicle regulations. So with some exceptions, such as Brazil and Argentina, one could sell almost anything in even powerful two-wheel vehicles or any kind of vehicles. And also there's a shortage in all the countries for infrastructure improvement. I'm just coming to the end, and I'm going to just stop 1 second on this table. This table shows colored dots. Red dots are countries. Every horizontal line is one country. I have deleted the number of countries because, they always get very upset. So just get the whole picture. There's a lot of red dots. And in columns, we have the petitions that the Federation, the Ibero-American Federation of Victims, produced at the beginning of the decade. So you can see here, I'm not going to stop because in all the columns, they mostly refer to post-crash care, but also to political will of creation of observatories and road safety education and driver licensing. So there's a lot of work to do. Some people, the most critical people said that was the decade lost. I like to see the lost decade. I like to see, the other half empty glass. And I think that, we are moving, and it is also reflected in the new global plan from the decade of action to the decade of delivery. So the foundations to the gains in the coming decade are still to be realized, but WHO released a lot of technical manuals and tools. We have regional observatories in place that should play a very strong role. There are many examples. I won't stop here, but we definitely believe that the work of NGOs in Latin America in Spain and in all the countries in the world is phenomenal. So without them, you know, we would be sailing without the lighthouse, without the compass, without the GPS. You know, I said before that in many agencies, there's a huge rotation of people. So if you come back to the country 2 years or 3 years after your previous visit, you know, you don't see a lot of known faces. That's a problem. But, you know, those that, you know, keep their motivation, that persist, are the victims associations, and there are a lot of good examples. And FICBI recently released, as a result of this report, new demands that added to the previous one on road safety crash data and punishment of reckless driving and so on. And just I would like to finish with some comments on what I think are the main new points, novelties of the new plan. You know, from some people would say that, you know, we are still calling it's called second decade, but actually it would be named the decade of delivery. I think it's very significant that the plan defines safe mobility as a human right, as a valuable public good. We could be talking about accessibility, mobility accessibility. The new action area, which is multimodality and land use, promotion of safe walking, of course, the safe systems approach above everything, the emphasis in the gender perspective and the role of women in the mobility system. The highlights is not just synergies with SDGs. It is mentioned in the plan as safe mobilities and enabler for most of the SDGs, such as access to jobs, education, gender reduction of poverty, gender inequalities, and so on. Of course, the new plan calls for a greater involvement of the private sector. There's a focus on speed management, and Margie mentioned that, you know, some of the participants in the let's say worldwide evaluation, they refer to that there should be another pillar on speed management. Well, we don't have pillars anymore, but we have a speed as one of the requisites in the new plan. And we are very happy to see that, you know, there's a couple of references to education as part of the road user behavior. It also includes graduated driver licensing systems as part of the driver licensing system in general. The new plan speaks up regarding, as I mentioned before, prevention of corruption in enforcement systems, very clear. I think it was in the first time that this issue was mentioned was as part of one IRTAD report. And, you know, it was very hard to really speak about this before. Of course, a star rating for roads and vehicle safety, you know, and very critical issue that was also highlighted during the presentation of the global plan a couple of hours ago. It was the need to ensure during import and export that vehicles are roadworthy, that not just those vehicles that wouldn't pass any minimum inspections in one high-income country go to a low and middle income countries. And also this reference about the dangers, the risks of new technologies that should be addressed as part of the new developments in this field. And finally, insurance premiums based on driver performance was something that I found interesting, and very also interesting. This, of course, let's say the post-crash area of the plan is much better, or touches or mentions key areas such as justice, rehabilitation, jobs for victims, incentives for the private sectors also to promote these jobs, but also the first aid training. That was very interesting, this first aid training for the community in general, starting with professionals such as heavy goods vehicles professionals, taxi drivers, and so on. One of the areas of activity of Fundación MAPFRE is the promotion among all kinds of schools, all kinds of segments of the population of first aid training. And okay, that's all from my part. So thank you for your time in listening. And thank you for letting us present in this evaluation report. Thank you.
Thank you so much for such an interesting presentation, Jesus. We have some time for Q&A, questions and answers, and thank you everyone for posting your questions. I will go ahead and ask one question to both of you, and I don't know which one of you want to take it, but in your opinion, how is the new global plan going to help achieve the target of 50% reduction in global road traffic injuries and deaths? And how is this plan different from the previous plan? Which one of you would like to take this first?
I can make an attempt. So how does the plan differ? I think the plan was developed, and so I have to, I have to tell you that I was involved in the first decade of action plans. So there was a somewhat of a conflict of interest here for me as far as that is concerned. But I think that the positive way that the second decade of action plan has been developed is a big plus. I know, for example, that on the review version that went out, there were 400 comments from across the world and many more from a country level. So I think the WHO really took on board a lot of the comments that we provided from our evaluation, particularly around the youth not having a voice. What they did was they actually had consultations with the youth. There was a special session around the decade with the members of yours and the Global Youth Activity Group. There was consultation with some of the NGOs to try and get their voices heard more. So I think, I think that it's been a balancing act, and I think that it certainly has filled a lot of the gaps that there were in the first plan. I'm still not 100% sure whether it is tangible enough. And the participant who said to me it was a decade of document writing kind of rings in my ears, because I look at all those documents that were developed during the decade, and yes, as a WHO staff member, I was partially to blame for that. And I really do hope that it truly is a decade of delivery, because I think we've been given a golden opportunity. The UN very rarely ever gives a second decade, and this second decade has been given. So I think it's a golden opportunity, and I think if we miss it, we really will run into a problem. But this high-level meeting that will be held in New York in mid-2022 should really try to hold governments accountable. And I see, a question here about what is the most critical level of engagement. And it really, I feel, is at a national level. Many of the high-level meetings and the resolutions that are passed, countries pay lip service to, and the people in New York know about it. And this came across during my discussions with country-level people as well. They said, well, the people sitting in our embassies in New York probably know all about this and are well-versed in it, but it doesn't trickle down. And I think one of the ways that it could trickle down is if there was some type of accountability framework. I'm not suggesting a tobacco framework, but I am suggesting a tobacco framework, if you know what I mean. I think some type of country accountability really has to be thought about. And I'm sticking my neck out there, but I guess I don't work for the UN anymore, so I can stick my neck out.
Thank you so much. Thank you. Fantastic. Jesus, would you like to add anything?
Well, I fully second and support what Margie said. I think that the plan has a very powerful leverage points, youth, and there was a question about youth. I think that, we need, I get concerned when I look at the people around in some road safety meetings and I see that maybe the average age is beyond 50. And it's not that they are most affected, it's that they have to continue our work. They have to improve actually the work that we are doing now, and that they have all these brilliant ideas. They see things in a very different way. You know, when I was younger, you know, the aspiration was to have a car. Now their aspirations, their expectations for the future are completely different. Things are, you know, gender perspective. Funding is a critical issue. So unless we mobilize more funding and the global plan, you know, I think makes this clear distinction between long-term funding that is mainly responsibility from the governments, and all the government levels are required. So there was a question about, you know, what's more effective. Of course, we need the national level, but, you know, unless we come down to the city level, where most of us live today, it won't be impossible to translate knowledge or will into action. And the second financing level is this short term, you know, that could cover short-term finance, that could cover some gaps, and where sometimes international donors or funders and the private sector could act and could, you know, have some catalyzing funds. But, you know, I think that and one very important development is that I think that the WHO is going to pay more attention to supporting countries in translating this global plan into the national strategies. And actually, if you look at I know that you know, the stakeholders of the WHO are the member states ourselves. The members are states, but, you know, it's probably good to, I mean, I was thinking there's not a lot of countries in the United Nations road safety collaboration. So it's, you know, we have, sorry for the ones that I won't remember now, but, you know, France, Sweden, Spain, there are actually from time to time some even African countries, Morocco, I think it's been attending some of the meetings, but, you know, it's a very limited participation. So, I mean, if we really need this plan to be effective, we need to mobilize more funding, more political will at national. I think that, you know, cities and regions, they're really happy, you know, to follow the path opened by the WHO in that sense. And so, I mean, we should be very optimistic at this point, but we should not waste any time, because we've lost, or we've expended 1/3 of the time frame for the Sustainable Development Goals, more than 1/3, and we've had to cope with the pandemic, but still, you know, there are many issues to think. But I mean, we are really running out of time for many issues, and we don't probably realize with enough intensity.
Thank you so much, Jesus. Yes, Margie, would you like to add anything?
Yes, I think just to let everybody know that, so the first decade was an unfunded mandate from the UN. And the second decade, I guess, is an unfunded mandate from the UN as well. But there has been funding that has been put on the table that has allowed WHO to actually employ somebody to run the entire decade, so that Nan Tran is not doing this as an add-on to everything else that he's dealing with, burns and falls and drowning and everything else. So there is a dedicated person, for those of you that know him, Mats Åkerballen from Sweden, who did work with us at WHO for a few years and then went back to Sweden and did a doctorate and has been guided. His mentor has been Klaus Tingwall, so he's very schooled in the safe systems approach. We'll be starting at WHO with a complete focus on actually supporting countries to implement this decade of action. So I think that is a huge plus and a huge step forward as far as delivery is concerned. As far as Adnan's question is concerned about, I guess, Adnan, you're getting at us, with those of us with gray hair. We do need to try and instill a much younger enthusiasm for road safety, because yeah, we're a generation of oldies now that are kind of leading the charge here, and I think it's coming. I don't know if any of you watched the WHO launch, but I was actually quite surprised that there was a rapper that was allowed on the, and rapped his song about road safety. So there's definitely a shift there. And with organizations like yours kind of trying to lead the charge and trickling that down to countries having youth parliaments, right down to young children taking letters to their mayors, etc. I think that if we can instill that right through younger generations at a country level, that then that would build up. But it's a very good point that you make, that, we can't preach to the choir anymore. And we do need to bring on another generation of young, enthusiastic people. And I think that the seeds of that have been sown through the Sweden conference. Jesús and I were just talking about the Youth Assembly, the World Youth Assembly that was held there. I mean, I think that we have to gather the leaders in this field from those kind of groups and really nurture them and bring them along with us.
Thank you so much, Margie. Jesús?
Thank you, Nino. Yes, I mean, when you see young people talking about road safety, how things should change, you say, wow, okay, these people, are able to do it. And I wanted to add two short comments. I was very happy that Margie, you just mentioned this, small students writing letters to the mayors. And actually, that's what we do in several countries. We support from MAPFRE Foundation in Spain and Peru and some countries. So that's part of our education system. And I also wanted to acknowledge or to refer to page 14 of the report, the Milken Institute and the George Institute report, with this table of funders of activities during the first decade, and then and there are hundreds of millions, literally hundreds of millions from Bloomberg Philanthropies, the immense work of the FIA Foundation, of course, the Botnar Foundation, the World Bank, and UK and Australia and Sweden, also aid agencies. So I just wanted to also refer back to those supports during the decade that connects to the sense during the evaluation that there had been funding at global level for capacity, for some activities, some specific city projects, but still that there's a lack of funding. There's road safety is clearly underfunded. And actually there was one figure earlier this afternoon during the presentation by the Prime Minister of Jamaica, and he said that health costs derived from road crashes amount $1.8 trillion globally. So I've never seen a trillion. I haven't used the word trillion with T so far. So that's so astonishing.
I agree. Thank you so much, Jesús. I think we're almost at time, but thank you both of you for such good discussion, because I think you addressed almost all questions that our participants had. In a conclusion, I can just say that it's very clear that progress was made during the first decade of action in 2011, 2020, for example, inclusion of the road safety in the global agenda for sustainable development, strengthening partnerships, and we saw a start of mobilization of resources for global road safety. The first decade also laid foundation for enhanced action in the second decade of action. This new decade of action is an opportunity, as both of you mentioned, to harness successes and lessons learned from the first 10 years of the decade. And the new plan that was launched today calls on governments and different stakeholders to change their action, to prioritize and implement an integrated safe systems approach, and help prevent millions of deaths from injuries and injuries by 2030. I think we have all a part to play in this action to achieve this goal. We know what works. I think we need to focus more on implementation. We have the tools, we have the knowledge. So I think it's time for us, all of us, to act. With that, I would like to thank our wonderful speakers for such interesting presentations and discussions. And thank you everyone for joining us today for this webinar. Thank you. Have a good day.
Thank you. Goodbye and take care.